Starting right now, province-wide, face coverings are mandatory in all public indoor spaces. And starting next Tuesday, in an attempt to limit long wait times, all COVID-19 testing at assessment centres across Ontario will be appointment only. It's a measure already implemented in Hamilton. But more importantly, the province is asking Ontarians to burst their social bubbles and, quote, allow close contact only with people living in their household and maintain 2 meters physical distancing from everyone else. Which prompted many reporters to ask about how families should adjust their upcoming Thanksgiving plans.
Keep the social circles tight. Don't go out and have the extended families of 20, 25 people.
So we're just asking people to be reasonable. Please try to keep your gatherings small to immediate households as much as possible.
So we haven't gone down to really tight definition of household because we want to say smaller. You have to refocus back down because we said 10, but people with 10, another 10 and 20, 30, and they just went open on that, and we have a problem now. So we say hunker back down, pick your ones carefully, and especially at this time.
The province also implemented special instructions for COVID hotspots, including Toronto, Ottawa, and Peel regions that include a cap of 100 socially distanced people in restaurants and 50 people in gyms and event spaces. The province's plan has drawn criticism online for not being strict enough. On the flip side, Toronto's medical officer of health is recommending prohibiting indoor dining altogether, shutting down all gyms, and instructing people to only leave their homes for essential trips, such as grocery shopping and work. Here's what Ford had to say about the blowback.
It's so easy when you aren't in the trenches to sit back and be the armchair quarterback.
But one Toronto area doctor is in lockstep with the concern.
I'll tell you what's going to happen. So case numbers are going to increase, hospitalizations are going to increase, ICU admissions are going to increase. Contact tracing will become impossible because the testing backlog will continue to grow. And the economic fallout from this will be far worse because the measures that you'll have to introduce a week or two from now will be far more severe and significant than what needs to be introduced today.
Hamilton's medical officer of health took to Twitter to voice her support for the idea of bursting our social bubbles. Dr. Elizabeth Richardson said that with businesses and schools reopening and many people returning to work, the concept of a social circle no longer reflects the reality of our daily lives.